Hi, everyone, and welcome to this Foundation Years vodcast. My name's Alex, and I'm a policy advisor at the Department for Education. Today, we're going to be discussing safer sleeping practices that early years educators can follow to keep babies and children safe in their settings. I'm kindly joined by Ellen from the Lullaby Trust. If you'd like to introduce yourself and maybe tell us about the work your organisation does.
Hiya, thank you everybody for joining us. So my name's Ellen and I'm the Public Health Engagement Manager at the Lullaby Trust. And so the Lullaby Trust is a charity which saves babies' lives and supports bereaved families. We're committed to supporting research to understand why babies die suddenly and unexpectedly in the UK and to find out more about how to prevent these tragic deaths. So the charity raises awareness of sudden infant death syndrome, also known as SIDS, and provides expert advice to help educate parents on how they can reduce the risk of SIDS and train professionals each year to support parents about sleeping their baby more safely. The charity offers emotional support for bereaved families via our free phone support line and also email. And we also support and arrange a team of befrienders who are bereaved parents, grandparents, and adult family members. Along with the NHS and other providers, we provide a Care of the Next Infant programme, also known as CONI, which supports bereaved families before and after the birth of their new baby. We also fund cutting-edge research into the causes and risk factors for SIDS.
Brilliant, thank you, Ellen. Within the early years foundation stage framework, there's a requirement for a separate baby room for children under the age of 2 years. When a provider is setting up the sleeping arrangements in a baby room, what do they need to know?
Yeah, so in a nursery environment, sleeping babies should be closely supervised. We don't advise on how nursery or earlier settings achieve these requirements, and it's down to your individual nursery's procedural guidance on how you meet this requirement. For example, a member of staff being present in a dedicated sleep room whilst the babies sleep, or frequent monitoring by members of staff in an open plan room. You can look at the Early Years Foundation Stage Framework 3.69 for further information.
So your safer sleep advice, is that for children up to the age of 1 year old?
Yeah, so our advice predominantly covers babies up to 12 months of age or 12 months from the due date of babies born prematurely. However, it's also important to consider how certain aspects of our safer sleep advice may be protective for toddlers or older children in your care, particularly in relation to accident prevention. For example, we would continue to advise that toddlers and young children continue to sleep on a firm, flat mattress after 12 months within an earlier setting to reduce the risk of suffocation and any other accidents.
So what else should early years educators know about choosing a mattress?
Yeah, so it's important for all mattresses to be firm, flat with a waterproof cover. A waterproof cover for a mattress is important for keeping it clean and dry and prevents the harbouring of any bacteria in the mattress. You should check that the mattress is still firm, flat, and in good condition with no rips, tears, or sagging, and that it fits the cot well with no gaps. We also recommend that a waterproof cover is wiped down with antibacterial spray and that a freshly washed sheet is used over the top of the mattress. All mattresses should be inspected and replaced immediately if there are any signs of damage. You should have a method to record when the new mattress was bought. For example, putting a sticker on the underside of the mattress works well.
Brilliant. So how should providers place babies in a cot, and what position should a baby be sleeping in?
Yeah, so all babies should be placed on their back for every sleep for both day and night, as the chance of SIDS is particularly high for babies who are sometimes placed on their front or side. Sleeping a baby on their front or side greatly increases the risk of SIDS. If using blankets or sheets, babies should be slept in the feet to foot position with the baby's feet at the bottom of the crib. The cot should be clear of unnecessary items such as toys, comforters, pods, duvets, and pillows. And we don't recommend the use of cot bumpers as they pose a risk to babies and toddlers, as there have been a number of cases in the UK and abroad where infants have become entangled in the ties and material or fallen from pulling themselves up on the bumpers. We would always advise, from the point of view of SIDS prevention, a baby should be slept on their back on a firm, flat, waterproof mattress, and that you do not incline, tilt, or prop the cot, mattress, or baby, as doing so will not help with reflux and is unlikely to improve cold symptoms.
Okay. Should providers use blankets in cots?
Yeah, so it's your choice if you choose to use a baby sleep bag or firmly tucked in sheets or blankets not above shoulder height for a baby to sleep in. The baby should be slept in the feet to foot position where the baby's feet are at the bottom of the cot, and you should avoid using soft or bulky bedding such as quilts, pillows, and duvets. And remember that one blanket doubled over counts as 2 layers. A baby sleeping bag is a good option as it reduces the risk of blankets or sheets being kicked off and covering a baby's head. But baby sleeping bags should be well fitted so that the baby can't wriggle down inside and that you use the correct TOG rating for the time of year. There is no need to use any additional bedding when you use a baby sleep bag.
And is it safe to use things to keep babies in one position, such as wedges or straps?
So we don't recommend sleep positioners, wedges, straps, rolled up towels, or anything that will keep the baby in one position. The evidence shows that the safest way for a baby to sleep is on a firm, flat mattress in a clear cot free of pillows, toys, bumpers, and sleep positioners. Babies are at a higher risk of SIDS if they have their heads covered, and some items added to a cot may increase the risk of head covering and can also increase the risk of accidents.
Okay. Once a baby starts to get a bit older and they start wriggling, moving themselves into different positions, what should educators do?
Yeah, so it's perfectly normal and natural for babies from approximately 5 months and upwards to roll onto their fronts or sides as they start to find their own sleeping position. You should continue to settle the baby to sleep on their back when you put them to bed. Once the baby has shown that they can roll from back to front and then to back again, they can be left to find their own sleeping position. However, until then, we recommend gently rolling your baby back onto their back if they roll onto their side or their front. You should ensure they're sleeping on a firm, flat mattress so that air is able to circulate around them and that they have a clear cot. During the day, when you're supervising the baby, you can give them plenty of tummy time and play games to encourage them to roll from back to front and to back again and to strengthen their arms and neck muscles.
Great. What should educators do when a baby falls asleep in a bouncer or anywhere else outside of their cot, Moses basket, etc.?
Yeah, so the safest place for a baby to sleep for all their sleeps, including daytime sleeps and naps, is in a Moses basket, cot, travel cot, or carry cot on a firm, flat mattress with a waterproof, wipeable cover. We advise against sleeping babies in a seated or inclined position. Sleeping in a sitting position can cause baby's chin to touch their chest and can fold the baby's airway, making it more difficult to breathe. If baby falls asleep in an item where they're sitting, we advise moving them to a clear, firm, flat sleep space. Bean bags, sofas, bouncy chairs, swings, hammocks, pods, nests, cushions, and car seats are not suitable sleep spaces for babies and significantly increase the risk of SIDS. If a baby falls asleep in a product like these, then you should move them onto a clear, flat, firm space.
As well, since babies are not able to regulate their own temperature, what can providers do to keep their temperature at a safe and comfortable level?
Yeah. So it's really important to make sure that baby's room is a comfortable temperature, not too hot or too cold, as the chance of SIDS is higher in babies that get too hot. So keep the room temperature between 16 to 20 degrees. Recording and documenting the room temperature during infant sleep helps ensure that babies are being cared for within the recommended limits. So it can be difficult to judge the temperature in the room, so we recommend using a room thermometer in the rooms where babies sleep. You should ensure that the baby's sleep place isn't positioned next to a radiator or next to a window in direct sunlight. And we wouldn't recommend using sleep spaces on the floor if the room has underfloor heating due to the risk of babies overheating. Babies also don't need to wear hats indoors or sleep in outdoor wear such as snowsuits or winter coats. And if a baby is asleep when they arrive at the providers or is returning from being outside and is wearing outdoor clothing, it's important that these are removed. All babies are different, so we recommend checking baby's chest or the back of their neck to make sure their skin doesn't feel clammy or sweaty to the touch. Their hands and feet will often feel cooler, but if they feel sweaty or clammy, it means they're too hot, so we recommend removing a layer of bedding or what they're wearing.
Okay. What do educators need to know about smoking risks?
Yeah, so there's really strong and consistent evidence from studies worldwide that smoking during and after pregnancy increases the risk of SIDS. Exposure to secondhand smoke also significantly increases the risk of SIDS, and the risk increases further where both parents or carers smoke. If you're caring for a baby, you might not know if their mum has smoked or whether the baby's been exposed to secondhand smoke in pregnancy or postnatally, and therefore you may not know if the baby's at higher risk. So it's very important to follow all the other safer sleep advice. Your place of work or employees will have a non-smoking policy, however, you still need to be aware of the risk of smoking and SIDS. The statutory framework for the earliest foundation stage says that providers must not allow smoking in or on the premises where children are present or about to be present. And cigarette smoke and the chemicals associated with smoking cling to clothes, hair, and skin, so we would advise against holding a baby after smoking. There's currently no research on e-cigarettes and SIDS, but using e-cigarettes seems to be safer than smoking due to the harm caused by the toxic chemicals in tobacco smoke. Giving up completely is the best option, but if you do choose to use an e-cigarette, you should continue to keep babies and children away from both e-cigarettes and their vapor.
Brilliant. Thank you so much. Is there anything else that providers should be aware of?
Yeah, so you might find there may be an occasion where parents or carers do something that goes against safer sleep guidance. For example, they may ask that their baby has slept in a pod or a nest, and you need to consider what you're going to do in these circumstances. For example, you could explain that you can't use it in your setting, and having something written down in policy or procedure document may help with this.
Are there any resources that you would recommend for settings to pass on to parents?
Yeah, so we have a number of resources available on our website and YouTube, including an easy read card available in over 20 languages, a product guide to support families purchasing items for their baby, and various animations. We also have resources specifically for earlier settings, including a booklet and a poster, which can be ordered via online shop. If parents or practitioners need any support or have any concerns around safer sleep, they can contact us for advice and support on our free information line on 0808 802 6869 or email info@lullabytrust.org.uk. We also train and provide information to professionals who support families to make sure that families receive consistent advice and are equipped with the knowledge to sleep their baby more safely. And we're developing training specifically for the earlier settings.
Amazing. Thank you so much for taking the time to speak to us about this really important topic. It's very appreciated.
Thank you. Thank you very much.